Moderator, it is the tradition of our church to offer a minute of appreciation for mission staff who have served for more than 10 years overseas. It is therefore a joyful task to pay tribute tonight to Dr. Richard Allen, who has worked almost 35 years for the Presbyterian Church in Canada. Rick Allen received his Doctor of Medicine degree from the University of Western Ontario in 1975, a diploma in tropical medicine and hygiene from the Liverpool School of Tropical Medicine in 1978, and a Master's of Public Health in 1984. His overseas service started in 1974 as a medical student in India. He went on to Nigeria and Nepal. He was appointed to the United Mission to Nepal to work at Amp Pipal Hospital, a 50-bed hospital reached by a 2-day walk off the main road. Pakistan was his next destination in 1984, where he served in a rural healthcare project. Upon return to Canada, he served as acting executive director for Presbyterian World Service and Development from September 1989 to August 1990. In 1991, he left church assignments to work as medical officer of health for the Baffin region with the government of the Northwest Territories, stationed in Iqaluit. Dr. Allen applied for service overseas again in 1994, and was appointed by the Life and Mission Agency to serve as Community Health Advisor to the Presbyterian Church of East Africa, known as the PCEA, based in Kikuyu, Kenya. As Secretary to the PCEA HIV/AIDS Committee, he coordinated the control program and served as Secretary to the HIV/AIDS Policy Committee. The training of trainers courses were started and a groundbreaking policy was written, which is considered by many as the most progressive HIV/AIDS policy of any church in Africa. In 2009, he began serving as lecturer in the Clinical Medicine Department of the Presbyterian University of East Africa, teaching an introduction to HIV/AIDS course. The government of Kenya requires all university students to take this course. Sub-Saharan Africa is the region in the world most heavily affected by HIV/AIDS. In Kenya, 1.5 million people are infected with HIV. Misinformation and a belief in many churches that AIDS was a disease of sin needed to be challenged. With the support of the PCEA leadership, Rick and his colleagues worked to debunk myths surrounding HIV/AIDS, correct misinformation, and support people living with the disease. They trained pastors and lay people who in turn taught community AIDS educators. Truly, this ministry in Christ's name saved many lives and will continue to do so. After 20 years of faithful service in Kenya, Dr. Richard Allen has expressed his desire to retire and return to Canada later this year. We give thanks to God for his time in India, Nigeria, Nepal, Pakistan, and Kenya, and pray that God will be with him as he looks forward to a happy, healthy, and active retirement in Canada. I present to you Dr. Richard Allen.
Thank you. Did you going to say something?
Yes, I have something.
Oh, wonderful.
Thank you very much. Let me say a few words about my time with the PCC overseas. Certainly, as I went out as a relatively young man to Nepal in the late 1970s, I did not think I would be working with the church for most of my adult life. But that has been the case, and all in all, my time with the church overseas has been a very good time. I've had the unique opportunity of working with people of different cultures and different religions. Nepal was mainly a Hindu society. Pakistan, an Islamic society. And Kenya, largely a Christian society. I experienced all sorts of government, including an absolute monarchy, a military regime, and varying forms of democracy. I remember feeling uneasy each time I went to a new country, wondering if I would be accepted. In general, however, this turned out not to be a problem. People were always friendly, showed us a sense of humor, and seemed to be understanding when I did things in a culturally awkward way. Most of my work in which I participated centered around community health and preventive health services. In Nepal, I worked in primary health care. In Pakistan, maternal child health and sanitation. And in Kenya, in the area of HIV and AIDS. My focus on preventive health services was mainly determined by the fact that such health interventions are in general cost-effective and are more able to have an impact on people in the disadvantaged socio-economic sectors. The last 20 years of my time overseas was in Kenya, working with the Presbyterian Church of East Africa, a very active and growing church. I hope that in the future, the partnership between the Presbyterian Church in Canada and the Presbyterian Church of East Africa continues to strengthen. For me, the Presbyterian Church in Canada has been supportive and caring beyond what one would expect of them. While overseas, there were, of course, a few difficult and challenging episodes. During those times, the PCC gave me their full support and guidance. People who have had the opportunity of working in different cultures and countries will often say at the end of the day that they have received much more than they have given. In my case, that is certainly true. As I conclude, I wish to thank the Church, both here in Canada and overseas, for this great opportunity to serve in the Christian ministry. God be with you all.
Thank you. Congratulations. Thank you so much.